Today we're talking about C5 and C6 disc herniations in the neck. Cervical spine discs C5 and C6 are the most common discs in the neck to bulge and herniate. This is because they're in the lowest portion of the neck, which carries the most of the weight of our head. And dynamically, what ends up happening is with bad posture, as our head starts to carry forward because of cell phones, tablets, working at a desk, using computers, maybe trades working downward a lot, or even myself as a chiropractor being over the tables. Posture plays a big role as the years go by. And as we lose the natural curve in the neck and become very straight, gravity starts to work against us. And what that means is that gravity is always a downward force towards the earth, meaning that it's trying to shrink us. And our job is to always try and elongate our spines and counteract gravity through proper sleep and exercise. Those are the two ways to try and counteract gravity. We sleep in a mattress horizontally to counteract gravity on the weight of our body, and then we do exercise and movement to help elongate and rehydrate all the tissue in our body. So those are the ways we do this. But if you cross paths with C5 or C6, you know what I'm talking about. It's excruciating neck pain. It can radiate down into the hands. We can actually map out which nerves they are. Typically C6 will make our thumb and index finger go numb. C5 will make the arm go numb or send a shooting pain down the arm. Sometimes people get really afraid if it's on the left side. They think it's their heart, so they'll rush straight to urgent care or ER and go through a cardiac exam, and they'll be cleared because their hearts are okay, but no one's really giving them answers for their neck. This will prolong for a while. And if this sounds like you, I'm sorry you went through that, but then you'll end up seeing a primary care or an orthopedic. They'll end up finally sending you for an MRI. And that's the best imaging that we can have of the spine, because we can see everything on an MRI. We can see the soft tissue, we can see the discs, we can see the spinal cord, we can see the fluid in the spinal canal, we can see all of it. And what it can show us is that when a disc bulge or herniation happens, it starts to intrude into that spinal canal. That's where all the problems start. Once we put direct pressure onto the nerves will send signals, and they're typically pain. The way nerves work is that they're like this super fast fiber optic cable. So think of it like an extension cord or a cable. If you put a little bit of pressure on that nerve, just a little bit, you squeeze it a little bit, you'll start to get a little bit of numbness. You'll feel a little numbness. That's the signal that will happen. If you push it a little bit more, you get like a tingling. I don't know if you've ever slept on your arm and woke up and they felt that tingling in the arm. It's because you choked off some circulation for a while to the nerves, and you get that tingling as the sensation starts to come back. That's a little bit more pressure on the nerves that happens there. If you put more pressure on that, now we start to get the pain. And the pain is the one that can become a dull, aching, consistent pain or a sharp shooting pain, depending on the amount of pressure we put on the nerve. You can even go one step further than that. If you put even more pressure on the nerve, this is usually from severe injury or severe swelling, it will decapitate or impinge the nerve completely, and we'll lose function. We won't be able to lift a coffee cup, you'll lose function, you'll lose grip strength, you'll lose a lot of the muscle strength. And if that stays for too long, you'll actually see the muscles start to decrease in size over time. It's called atrophy. That's dangerous. And that's immediate surgery for that one. But typically, people will tolerate pain up to a certain point. So the numbness, the tingling, they'll live with for months. The pain, the dull aching pain, starts to get a nuisance. And then the sharp pains, people are trying to find answers right away. An orthopedic surgeon will look at this and, based on the pain that you're having, dictate whether surgery is necessary or not. And in the cervical spine, the most typical things that they'll do is either a laminectomy, they'll remove the back portion of the bone to open up the spinal canal to give pressure off of that area, or they'll go in and do a disc replacement in there. They'll completely fuse the C5, C6 together. Those are the most common ones that we see in the office. Our goal is to catch these patients before they ever need surgery, before they ever decide to do surgery. And you say, well, what are you going to do for them naturally that can actually help a C5 or C6 disc herniation? Well, there's a couple things we need to do and know about the cervical spine. Unlike the rest of the spine, the cervical spine is really delicate because the brain is here and the brainstem is in the upper portion of the neck. Most neurosurgeons don't want to come anywhere close to the brainstem. So by the time you get to C4, 5, and 6, they get a little bit more comfortable with it, and they'll go through the anterior portion because there's less muscles to cut through, and they'll go through here to do the surgery. And they're very good at what they do, and they come out very clean. But when we start to fuse and put hardware in here, we lose a lot of range of motion of the neck, which only accelerates degeneration further. So that's why we want to try and prevent patients from going there and try and help them naturally. And how we do that is by spinal decompression. So we traction the spine and open it up and create a reverse negative pressure for the C5 and C6 discs specifically, and hold that there for a certain amount of time. The machine we use here for medical grade spinal decompression will actually focus on certain discs based on pressure and weight. And then we can also pulse that. So it'll be a pulsing sensation of pulling and then releasing it. Pulsing sensation and releasing, and that can go on for 15, 20, 25-minute sessions, depending on what is tolerable for the patient there as well. Then we want to rehydrate the discs through proper nutrition and movement, and with some chiropractic in there as well, or laser therapy, you can reduce pain very quickly. So what happens with the C5, C6 patients in our office is that they're in pain. Maybe they were just in a car accident, or something happened, they slipped and fell, or a sports injury, whatever happened acutely, they're here, and that's the program that we put them on right away. If you know anyone that's had a C5 or C6 disc bulge, herniation, or injury, reach out to us. We love answering these questions and going through any of the outcomes or protocols that they may be able to do themselves and find relief for themselves as well. Another great thing for most people with healthy necks is to try and, this is a straight neck, by the way, because of the way the model is made. What we want to do is have a banana-shaped curve here. And the best way to mold that is by putting a towel underneath the neck, about the size of a pool noodle or the diameter of your hands together. That's what I teach most patients. Roll up a towel nice and tight, put that right underneath the neck, and let that hold the neck position for 15 minutes before you go to bed every night with no pillow behind the head. So we want to be lying down like this, the head elevated off the ground with a pillow that's putting us into that banana-shaped curve. It's a great way to offset the full day that we do, that we work on the computer, or we're working with our hands, or we're seated at a desk all day, or maybe we're on the phone a lot. It's a way to counteract that and restore or support that natural cervical curve in the neck. If you have any questions, reach out to us, info@fullifetampa.com. We love answering them, and stay well.